Hello everybody, my name is Michel Bolac and I would like to invite you to participate to a webinar, an upcoming webinar about the increasing risk from pandemic for a person with epilepsy and the approach with newer anti-epileptic drug treatments. So we are all surprised by the number of neurological symptoms that can be associated with COVID-19, the neuro-COVID symptoms. But we are also much concerned by the impact that this disease may have upon our patients with chronic neurological condition and epilepsy in particular. And there are many questions asked by the patients, by the caregivers, by medical doctors. So are persons with epilepsy at higher risk regarding COVID-19? Are they more predisposed to contract the infection? And are they more at risk of developing the most severe forms of the infection? Then there are some more specific issues. Does SARS-CoV-2 precipitate or aggravate existing seizures? And there are a lot of pharmacological issues. I mean, does the anti-epileptic drugs aggravate the COVID symptoms? Reciprocally, the treatment used for COVID-19, do they influence the epilepsy? And finally, what are the direct drug-drug interactions? I will come back on this in 1 minute. And very importantly, we need to tell people, to bring them some general principles for safety, how to manage epilepsy, for instance, to avoid unnecessary hospitalization or visit to hospitals, to avoid all circumstances that may aggravate epilepsy, lack of sleep, we must secure the drug supply, and above all, we must reassure persons with epilepsy, we must reassure their family, their caregiver about the consequences of COVID infection upon their disease. And to give you more detailed notions about the pharmacological questions that we may have. We have now a lot of drugs which are used in COVID-19 treatment on the left. Not all of them are confirmed or approved. And we have on the right all our list of anti-epileptic, more anti-seizure drugs. And the first question, could antiviral drug aggravate epilepsy? The second question is the reverse. Could anti-epileptic drug aggravate COVID-19 symptoms? And we may have pharmacodynamic interactions. For instance, some antiviral drug may act on the ECG parameters, the PR or the QT intervals, as do some anti-epileptic drugs. So can there additional pharmacodynamic adverse effects? And there might be also pharmacokinetic interactions. We know that anti-epileptic drugs may be enzyme inducers, enzyme inhibitors, may be neutral, and this neutrality regarding interaction would be a very good principle for selecting anti-epileptic drugs. So thank you for your attention and see you at the upcoming webinar. Bye-bye.